Your lungs are amazing organs, and if you think about it, they are the only internal organs that are constantly exposed to the environment. Your lungs are responsible for distributing oxygen to the body through a thick network of blood vessels. To neglect your lungs can create a low supply of oxygen in the body, which can, in turn, affect other organs. October is National Healthy Lung Month, created to shine a light on the importance of lung health and the possible ways to avoid lung health issues. Ed Neuzil, board-certified nurse practitioner at Allergy, Sinus, and Asthma Family Health Center, explains some of the conditions that can threaten our lung health and what can be done to treat them.
When we talk about the bronchial tree, it's much like a regular tree. If you pull it out of the ground and you put it on your chest, you have a big trunk, and then it goes out and branches as you go. Well, the same kind of thing happens in the lungs. We call it a bronchial tree. If somebody's having any of the respiratory symptoms, there can be coughing, there can just be a little short of breath. For that patient that does come in and have wheezing, then we do spirometry to look at their pulmonary functions. And then we will give them a short-acting bronchodilator, and if they respond to it and their airways actually reverse within a certain percentage, then that's diagnostic of asthma. And if you were to have mucus that completely blocks those bronchioles, no breathing occurs. So you can end up with a, so to speak, walking pneumonia that's minimal, or you can end up with a pneumonia that encompasses most of the airways, and that's where people end up in the hospital and unfortunately sometimes pass away because there's no way to get oxygen into the person. So we have to be very careful that if your symptoms last for an unreasonable amount of time, that you really get to your medical provider to get it treated. Now, for those individuals that have a smaller airway, like those with asthma or those with COPD, you can understand that now you have a smaller airway, it doesn't take as much to close off the airway and develop pneumonia. So those people that have COPD and have more of a history of pneumonias, they need to be treated right away. And usually providers will be more aggressive with the use of antibiotics and so forth because of that indication. Those individuals that have a tendency towards pneumonia, or actually anybody, we need to look at our vaccinations. The flu shot is something that people really need to receive, if not contraindicated, every year. The pneumonia vaccine is something that's given generally once before the age of 65, once after the age of 65, as long as there's been 5 years in between. Some have received it every 5 years, but there's really no study that shows that benefits, but there's no study that shows it hurts. So some individuals, providers, because of patients' inherent tendency towards developing pneumonias, will give it on a more frequent basis just for that prevention.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Healthy Lungs tab on our homepage, yourhometownhealth.com.